I'm Dr. Peter McCullough, and this is Focal Points. This is a breaking story about the US FDA conceding 10 pediatric vaccine deaths after the COVID-19 messenger RNA vaccine administration. A leaked memo indicated that Dr. Vinay Prasad, an FDA staff member, messaged others in the Division of Biostatistics within the FDA, indicating that of 96 cases reviewed, 10 deaths were ascertained due to the COVID-19 vaccine. Now, these are in children, notably, who would have little or no risk from the acute SARS-CoV-2 infection. Another FDA staff member, Dr. Marty Makary, was on the television news stations over the weekend, indicated that the FDA will make changes in terms of how they evaluate vaccines. Very importantly, they won't trust antibody responses because antibodies are not an adequate surrogate for immune protection. They are a good surrogate for antigenic exposure, but not immune protection. And that they will require the vaccines to actually reduce significant clinically meaningful outcomes. And hopefully that means reductions in hospitalization and death for infectious diseases. Now, people have asked me, well, Dr. McCullough, aren't these two doctors heroes? And like so many of the new HHS and White House administration, my view is that it's a mixed picture. Now, both of these doctors were, on the frequent commenters list on major news stations, including, I was in that group too as well at Fox News and others. So they were well aware of certainly my concerns and our concerns regarding the vast number of COVID-19 vaccines, injuries, disabilities, and deaths. I had been widely publishing on this topic and reproducing the work of others, documenting autopsy-proven pediatric deaths. In 2021, Gill and colleagues published 2 young children died from COVID-19 vaccine-induced myocarditis, and they underwent autopsies, and this proven to be fatal. That was in 2021. So why are these 2 doctors now coming forward in 2025 with this new revelation? And the first comment I'd say is that A, is way too late. B, that these 10 deaths are the tip of the iceberg. There is a vast number of deaths in the peer-reviewed literature. These cases have already been vetted. We don't need FDA officials to comment on them. They're deeply concerning. And then our US CDC Vaccine Administration Adverse Event System, VAERS, has in total now, this is shocking for United States residents, 19,480 deaths. About 2,000 of these have occurred right within 48 hours of the shot. And then 19,279 Americans reported to be permanently disabled. These are reported to VAERS by doctors like myself who have already determined the vaccine is the cause of the injury, disability, or death. Because if the vaccine was not the cause, then we wouldn't do the report to VAERS. So the VAERS, it does indicate causation by proxy of reporting. This is very important. The VAERS system, I'll say it again, indicates the vaccine is the cause of the problem because the doctor or the healthcare provider in the field at the scene who's examined the patient, examined the autopsy and the medical record information, examined the clinical record and the vaccine administration has determined the vaccine is the cause. Otherwise, a VAERS report would not be made. So this is very important. I would say at this point in time, both Makary and Prasad should immediately call for the COVID-19 vaccines to be removed from the market. Every day they continue to delay on this, the more Americans will be hurt by boosters. We've already had several hundred deaths this year that have occurred on their watch. B, they should initiate a safety review of the 19,480 deaths with an independent panel to review all the information. The CDC has the patients and the families' phone numbers, emails, addresses. There ought to be interviews of family members for the deceased, interviews of the patient themselves for injuries and disabilities to get their side of the story. The CDC has all that information. The review should be done independently by people who are not CDC or FDA employees. and there should be multiple reviewers and should be an adjudication process and finally a determination of causality for the vaccine. And then I would say, finally, the FDA officials, including Makary and Prasad, needs to start showing up to important proceedings in Washington. There have been multiple hearings on vaccine safety. One that I was the lead witness on, May 21st of 2025. We published a report indicating that there was a government cover-up of COVID-19 vaccine-induced mild pericarditis, including fatal cases. This was held in the Russell Building in the U.S. Senate in Washington, and Makary and Prasad did not show up to get the important information. They have not indicated in any of their statements that they've even read the final report from the Homeland Security and Governmental Affairs Permanent Subcommittee on Investigation's conclusion that there was a government cover-up going back to early 2021 to conceal COVID-19 vaccine-induced mild pericarditis, predominantly among young people, including fatal cases. So, in conclusion, I think the recent FDA deliberations and statements regarding 10 deaths and the fact that it had to be leaked, they didn't come out with a press release on this, they didn't come clean with a forthright presentation to American people, and their statements that have followed. In summary, it's a mixed review. I think there should be some encouragement. There is just a sliver of intellectual honesty. There's just a morsel of medical prudence from the FDA staffers, but it's far from what America deserves. A recent Rasmussen survey indicates 10% of those who took the vaccine have serious medical problems from the vaccine. They're furious, and I think they continue to be furious, justly so, at the FDA for their lack of action. I'm Dr. Peter McCullough, president of the McCullough Foundation, and thanks for listening to Focal Points.